The first one is Liam Horgan, a consultant surgeon who helped to set up a laparoscopic surgery service in Tanzania starting in 2003. He's also the director of a training institute. So for him, he already has the ability to train international students and has the experience of setting up a service from new. And he has said that being able to be part of a link is very important to him. And if he were to move or go somewhere else to work, he would look for someone with an international link. Now, Judith Cobb, in the top photograph, first started a link with ultrasound, actually, in our link hospital. And she immediately was thrown into it. There isn't a service at the moment. There certainly isn't a service serving the remote outreach areas. What can we do about it? She really went through the rungs of leadership development, trying to think about how she could take that situation, plan it strategically, overcoming obstacles about resources. She went through everything very clearly. And as a result of that, over a number of years, Judith actually achieved the position of head or lead sonographer within our trust, and rightly deserved to. And again, teamwork. How often do you go somewhere in a team where you've got engineers, you've got physiotherapists, surgeons, all different kinds of disciplines? Normally, those people would not be in the same room together because you wouldn't have that opportunity within the UK. So in this picture, in the centre of the photograph, a little blonde head hiding, is in amongst Tanzanian surgeons, engineers, director of surgery, managers. So you're working across the board. You're learning about the issues to do with costs of healthcare delivery. You're learning how to troubleshoot. And in this particular case, Sue now leads an online nursing forum, and she's involved in development of training materials for international students. So a big journey for her, but you can also collaborate, as many of you do, with universities. So you've got a joint university and healthcare link. And this particular link, actually Professor Richard Walker, who is sitting at the back there, is the clinical lead for the Northumbria link. His next door neighbour, as it happened, Professor Ellis, and he worked together to sponsor this particular link, where clinicians came together with educators to help to develop a Bachelor of Science degree in physiotherapy. And by providing support from the NHS side, you were able to really push forward on the development of that degree. And as you can see, the first students are graduating there. This particular case study was quite interesting because this, just in March this year, Alastair Hayes was actually in Tanzania while he was waiting to get notice about his ST3 interview. So he was on the internet as much as the internet was there to be sort of got into. So he said that his experience really was wonderful for his career development and for his leadership development, and he was able to put forward a portfolio of evidence from his interview, which created a good talking point as much as anything, but showed that he'd been able to thrive in a really challenging arena and get a lot out of it. He was able to identify all of these skills. So he was involved in undergraduate teaching. As you can see, he's involved in teaching on a simulator for laparoscopic surgery. He helped to facilitate and was part of the faculty to facilitate a national laparoscopic course. But from the skills that he'll take forward into his new rotation, he is involved in the curriculum development. He's working up an undergraduate module and a master's module for laparoscopic surgery. And he'll be able to take forward all the experiences to his new hospital, all the skills that he's learned. This was quite a tough challenge for Veronica, one of our general managers who deals in facilities. It's not all about front of house, it is back of house too. It's about infrastructure, because without the infrastructure, the front of house actually doesn't get to happen. And a lot of investment, even within the NHS, is usually front of house rather than back of house. And we can see this when we visit our colleagues overseas. Veronica was able to do a needs assessment, build up a business case, and come up with some solutions as a joint effort with our colleagues overseas to take forward a 5-year development plan for a certain area. As you can see, catering was one of the areas. But she said to me, it's really difficult because a lot of what I do as a general manager is around my power base. If I want something done, I can get it done because I'm the general manager. But when I'm out there, who knows who I am? I could be the lollipop lady who's just come across the street. You know, I have no relevance to anybody, but I had to use my negotiating and influencing skills in order to get my points across. So she's learned about how you can do things instead of, well, I don't know, that looks too hard. We can do it, and we can do it with less resources. And she speaks at the board meetings, business unit meetings, and is challenging people all of the time. This is Helen Boone, one of our first nurses, who a lot of people come back with renewed dedication for the NHS. They're totally fired up, they're so excited about being part of what they're part of. And she first went in 2001, there's a photograph of her with her first tissue viability class. She was so inspired, she took time out and she spent about 3 years with Mercy Ships, came back to lead the community nursing unit, and she's now our lead nurse on a UK aid project to develop her burns. So it has lots of different benefits back to the NHS. And Wendi Shepherd, here on the right, we helped to facilitate an NHS management graduate trainee scheme. I said that the wrong way, but anyway. And we helped to facilitate that with an MSc on a project around costing of healthcare in Tanzania. Wendi came back again, totally committed to a career in healthcare, and is now doing a Master's in Development Management. You might have heard in the papers or I think it was on the television about 2 weeks ago about the launch of NHS Global, or the idea of NHS Global. This is just to say that really the experience we have through links can only enhance the reputation of the NHS on a global level. When we take part in international links, it helps us to function in really quite challenging circumstances sometimes, so we can be transported and function very well overseas. We are able to experience teaching and training internationally, and also, which is really important, getting to grips with things from grassroots level, working with our colleagues together at the bottom line so that we can work together to get the next steps up, and that leads to sustainability. So how can we spread the word? Well, you can use a toolkit to gather evidence, and part of the research that I undertook some time ago, I'm now developing a toolkit which is to gather knowledge and skills from international work for the purposes of annual appraisal in an attempt to help operational managers understand exactly what you do when you go overseas. And if you have this evidence, it can be used for other things too. And also FLIR and NHS South Central have developed a leadership toolkit which will also capture those gains, and they're very important toolkits to be used in evidence to your board. So we need to do a lot to gain public support as well about promoting what we do. In Northumbria we use photo exhibitions explaining about the projects. We go out to speak at local communities, etc. So you need to spread the word, raise the profile and gain support. Now I just want to read very quickly to you an extract from the research, which I thought was quite inspirational actually. I believe that employees of the NHS who are involved in international work, we come back with renewed vigour and we're more open-minded. We appreciate the role of the NHS in healthcare as a whole for the nation, and then the role of that globally. We know what a wealth of resource it is and how lucky we are to have it. We come back with positivity, with energy and with hope really, and with dedication to healthcare, because you know how massively important it is to every nation. And the other thing you come back with is a sense of humour. Okay, thank you very much.